A prescription for hydromorphone 4 mg tablets requires 60 tablets, but the pharmacy only has 8 mg tablets in stock. How many 8 mg tablets should be dispensed after verifying with the pharmacist? A. 15. B. 20. C. 30. D. 45. Answer, B. Each 8 mg tablet equals 2 4 mg doses. To fill 60 tablets of 4 mg strength, the patient needs 30 tablets of 8 mg. However, each dose must be halved. 30 full tablets equals 60 half doses. Pharmacist authorization required before substitution. A pharmacy technician reconstitutes an antibiotic suspension that must be stored in the refrigerator. The label says discard after 14 days. If mixed on March 2nd at 4 p.m., what is the final expiration time? A. March 15th at 11:59 p.m. B. March 14th at 4 p.m. C. March 17th at 12 a.m. D. March 16th at 4 p.m. Answer, D. Counting starts from the time of reconstitution. 14 days later is March 16th at 4 p.m. Which USP chapter specifically governs sterile compounding practices? A. Less than 795. B. Less than 797. C. Less than 800. D. Less than 1075. Answer, B. USP less than 797 outlines environmental, personnel, and procedural standards for sterile compounding. A patient taking warfarin asks for an over-the-counter pain reliever. Which should the technician alert the pharmacist about due to interaction risk? A. Acetaminophen. B. Diphenhydramine. C. Lidocaine patch. D. Ibuprofen. Answer, D. Ibuprofen increases bleeding risk with warfarin. Pharmacist must recommend safer alternatives like acetaminophen. A technician preparing a chemotherapy agent in a vertical laminar flow hood must wear which combination of PPE? A. Gloves and gown only. B. Double gloves, gown, face shield, and respirator. C. Single gloves and mask. D. Hairnet and gloves only. Answer, B. Cytotoxic drug handling, USP less than 800, requires full protective gear, double chemotherapy-rated gloves, disposable gown, face shield, and respirator. A medication order reads, infuse 250 milliliters over 90 minutes. What is the infusion rate in ml/hr? A. 120. B. 150. C. 166.7. D. 180. Answer, C. 250 milliliters divided by 1.5 hours equals 166.7 milliliters per hour. Which schedule of controlled substances allows refills up to 5 times within 6 months? A. C3. B. C2. C. CI. D. CV. Answer, A. Schedules 3 and 4 allow up to 5 refills within 6 months from the issue date. A technician enters 0.5 mg as 5 mg by omitting the leading 0. What error category best describes this? A. Wrong patient. B. Wrong drug. C. Wrong dose. D. Wrong duration. Answer, C. Missing a leading 0 leads to a 10-fold dose error, classified as wrong dose. Which auxiliary label should be attached to metronidazole tablets? A. Take on an empty stomach. B. Avoid alcoholic beverages. C. Take with milk. D. May cause drowsiness. Answer, B. Combining metronidazole with alcohol causes a disulfiram-like reaction. The controlled substance inventory must be performed. A. Quarterly. B. Annually. C. Every 2 years. D. Monthly. Answer: C. DEA regulations require a biennial inventory of all controlled substances. Which of the following is an isotonic sodium chloride solution? A. 0.9% NaCl. B. 0.45% NaCl. C. 3% NaCl. D. 5% NaCl. Answer: A. 0.9% sodium chloride has the same osmotic pressure as body fluids, considered isotonic. Which medication must be dispensed in its original, light-resistant container? A. Furosemide. B. Nitroglycerin sublingual tablets. C. Lisinopril. D. Hydrochlorothiazide. Answer: B. Nitroglycerin is unstable to light and moisture. It must stay in the manufacturer's amber glass bottle. A technician notices of tall man lettering format on a label reading prednisolone. Its purpose is to: A. Emphasize brand name. B. Highlight expired drugs. C. Meet insurance coding rules. D. Prevent lookalike medication errors. Answer: D. Tallman lettering differentiates lookalike drugs like prednisone and prednisolone. Which federal act requires child-resistant packaging for most prescription drugs? A. Kefauver-Harris Amendment. B. Poison Prevention Packaging Act. C. Controlled Substances Act. D. Durham-Humphrey Amendment. Answer: B. The Poison Prevention Packaging Act, 1970, mandates child-resistant containers for patient safety. A technician calculates 240 milliliters of suspension at 10 milligrams per milliliter. How many milligrams of drug are present? A. 2,400 milligrams. B. 2,000 milligrams. C. 1,800 milligrams. D. 2,000 g. Answer: A. 10 milligrams times 240 milliliters equals 2,400 milligrams total drug content. Which storage condition is required for insulin vials once opened? A. Frozen below 0 degrees Celsius. B. Room temperature for 28 days. C. Refrigerated indefinitely. D. Keep under direct sunlight. Answer: B. Most opened insulin vials can remain at room temperature for up to 28 days before discarding. When a medication is prepared in an amphora mixture hood, which area should the technician work within? A. 1 inch from the back. B. Within 6 inches of the front edge. C. Directly on the side walls. D. At least 3 inches inside the hood. Answer: D. To maintain laminar airflow, work 6 inches inside the hood and 3 inches from the sides, closest to D. A controlled substance prescription is missing the prescriber's DEA number. The technician should: A. Add it from previous records. B. Ignore it and fill. C. Alert the pharmacist to verify with prescriber. D. Submit under the pharmacy's DEA number. Answer: C. The pharmacist must verify any missing DEA information before dispensing a controlled drug. Which medication requires a do not crush label due to extended release properties? A. Metoprolol ER. B. Loratadine. C. Furosemide. D. Acetaminophen. Answer: A. Extended release tablets should never be crushed as it destroys the release mechanism. Which drug class is most associated with statin-induced myopathy? A. Antidepressants. B. Lipid-lowering agents. C. Antibiotics. D. Antipsychotics. Answer B. Statins may cause muscle pain or rhabdomyolysis, a severe side effect monitored by pharmacists. A technician receives a DUR, Drug Utilization Review, alert for therapeutic duplication. What does this imply? A. 2 drugs of the same class prescribed. B. Drug contraindicated in renal disease. C. Incorrect patient allergy entered. D. Drug lacks dose adjustment. Answer A. Therapeutic duplication occurs when multiple drugs from the same class are prescribed unnecessarily. Which type of prescription requires tamper-resistant paper under federal law? A. All antibiotics. B. Controlled substances. C. Antihypertensives. D. Vitamins. Answer B. Controlled substances must be written on tamper-resistant pads to prevent forgery or alteration. The Red Book is primarily used in pharmacy for A. Drug interactions. B. Pharmaceutical calculations. C. Pharmacology studies. D. Pricing and product information. Answer D. The Red Book provides average wholesale prices and product availability for pharmacy operations. Which part of the NDC number identifies the specific drug and strength? A. First segment. B. Second segment. C. Third segment. D. None of the above. Answer B. NDC format, labeler, product, package. The second segment denotes product and strength. What is the primary purpose of the Beyond Use date on compounded medications? A. Manufacturer recall tracking. B. Patient identification. C. Chemical stability assurance. D. Inventory restock reminder. Answer C. The Beyond Use date ensures product potency and sterility until that time limit. A prescription reads morphine sulfate 15 mg IMQ4-HPRN for pain. The technician should identify this as which schedule medication? A. Schedule 1. B. Schedule 2. C. Schedule 3. D. Schedule 4. Answer B. Morphine is a Schedule II controlled substance due to its high potential for abuse and dependence. When compounding a non-sterile ointment, which device provides the most accurate measurement for a small liquid volume? A. Graduated cylinder. B. Conical graduate. C. Syringe without needle. D. Beaker. Answer C. A syringe provides the highest precision for measuring small liquid volumes in non-sterile compounding. A refrigerated vaccine is accidentally left at room temperature for 5 hours. What should the technician do first? A. Document and notify pharmacist for manufacturer stability guidance. B. Rechill and continue use. C. Discard immediately. D. Administer to patients immediately. Answer A. Technicians must document the incident and follow manufacturer stability data before discarding or using the vaccine. Which of the following is required on a unit dose package prepared in a hospital pharmacy? A. Patient name and address. B. Manufacturer's phone number. C. Drug name, strength, and expiration date. D. Cost of medication. Answer C. Each unit dose label must include at least the drug name, strength, and beyond use or expiration date. What is the total volume to be dispensed for the following order? Amoxicillin 500 mg POTID x 10 days, if each 5 ml contains 250 mg. A. 100 ml. B. 150 ml. C. 200 milliliters. D. 300 milliliters. Answer, D. 500 milligrams equals 10 milliliters per dose. TIDX 10 days equals 30 doses. 10 milliliters times 30 is equal to 300 ml total. During hazardous drug preparation, where should all waste materials be disposed? A. Regular trash bin. B. Red biohazard container. C. Yellow chemotherapy waste bin. D. Blue sharps container. Answer, C. USP less than 800 requires hazardous waste to be disposed of in yellow chemotherapy waste containers. A technician receives an alert for lookalike/soundalike confusion between Celebrex and Celexa. What action should be taken? A. Ignore the alert. B. Dispense whichever is cheaper. C. Verify with the pharmacist and prescriber before processing. D. Choose by the dosage form. Answer, C. These drugs differ in indication. Pharmacist verification prevents serious dispensing errors. The pharmacy refrigerator temperature should be maintained between A. 0 to 5 degrees Celsius. B. 2 to 8 degrees Celsius. C. 8 to 12 degrees Celsius. D. 10 to 15 degrees Celsius. Answer, B. The proper storage temperature for refrigerated medications is 2 to 8 degrees Celsius, 36 to 46 degrees Fahrenheit. Which regulatory body enforces the Controlled Substances Act? A. FDA. B. DEA. C. CDC. D. EPA. Answer, B. The Drug Enforcement Administration, DEA, enforces all regulations under the Controlled Substances Act. Which term refers to a drug that produces the opposite effect of another? A. Agonist. B. Synergist. C. Antagonist. D. Prodrug. Answer, C. An antagonist binds to a receptor but blocks its activity, producing an opposing effect. A prescription for metformin 500 mg BID is written for 90 days. How many tablets are needed for the full supply? A. 90. B. 120. C. 180. D. 200. Answer, C. 2 tablets per day times 90 days equals 180 tablets. What is the primary reason for medication recalls? A. Overpricing. B. Label misprint or contamination. C. Low sales. D. Packaging color mismatch. Answer, B. Recalls occur when drugs pose health risks due to contamination, mislabeling, or potency errors. Which dosage form bypasses first-pass metabolism? A. Oral tablet. B. Rectal suppository. C. Sublingual tablet. D. Capsule. Answer, C. Sublingual absorption enters systemic circulation directly, bypassing hepatic first-pass metabolism. When mixing 2 incompatible 4 medications, what may occur? A. Increased potency. B. Chemical precipitation. C. Delayed release. D. Sterility improvement. Answer, B. Incompatible drugs may cause chemical reactions leading to precipitates or reduced effectiveness. Which type of recall poses a reasonable probability of serious health consequences or death? A. Class 1. B. Class 2. C. Class 3. D. Class 4. Answer, A. Class 1 recalls indicate the highest risk to health and require immediate removal. Which law established the distinction between prescription and OTC drugs? A. Controlled Substances Act. B. Pure Food and Drug Act. C. Durham-Humphrey Amendment. D. Hatch-Waxman Act. Answer: C. The 1951 Durham-Humphrey Amendment created the categories of prescription and over-the-counter drugs. Which auxiliary label should be placed on a prescription for metformin? A. Avoid alcohol. B. Take on an empty stomach. C. Refrigerate before use. D. May cause drowsiness. Answer: A. Alcohol with metformin increases the risk of lactic acidosis. A technician must compound 150 ml of 0.9% NaCl using 70% NaCl stock. How many ml of stock are needed? A. 1.5 ml. B. 2.0 ml. C. 1.9 ml. D. 150 ml. Answer: C. Use formula C1V1 equals C2V2, 70, V1 equals 0.9, 150, V1 equals 1.93 milliliters. Which medication is classified as an antiplatelet agent? A. Clopidogrel. B. Enoxaparin. C. Warfarin. D. Heparin. Answer: A. Clopidogrel inhibits platelet aggregation, others are anticoagulants. When counting hazardous tablets, the technician should: A. Use bare hands. B. Count using a designated tray and spatula. C. Use any available tray. D. Use paper counting sheets. Answer: B. Dedicated counting trays and spatulas prevent cross-contamination of hazardous drugs. Which of the following organizations accredits pharmacy education programs? A. ASHP. B. NABP. C. FDA. D. ACPE. Answer: D. The Accreditation Council for Pharmacy Education, ACP, accredits U.S. pharmacy training programs. A technician receives an alert medication expired. What is the correct next step? A. Cover with new label. B. Return for reverse distribution or disposal. C. Dispense if visually intact. D. Mix with new stock. Answer: B. Expired medications must be removed and disposed of properly per DA or manufacturer guidelines. Which schedule allows limited amounts of certain narcotics in cough preparations? A. C2. B. C3. C. C4. D. CV. Answer: D. Schedule 5 drugs include low concentrations of narcotics, such as codeine and cough syrups. Which of the following drugs should be dispensed in a glass container to maintain stability? A. Amoxicillin. B. Nitroglycerin. C. Omeprazole. D. Albuterol. Answer: B. Nitroglycerin tablets are moisture and light sensitive, requiring storage in glass containers. A technician prepares 250 milliliters of 4 solution labeled 2 milligrams per milliliter. How many grams of drug are required? A. 0.25 g. B. 0.5 g. C. 1 g. D. 2 g. Answer: B. The solution is 2 mg per milliliter times 250 milliliters equals 500 milligrams total. Then convert milligrams to grams. 500 milligrams divided by 1000 is equal to 0.5 g.